So this scenario says the clinic nurse is caring for clients in a pediatric clinic. Which client should the nurse assess first? This is a priority question. Answer number 1, 4-year-old who fell and is complaining right now of left leg pain. So how am I going to analyze answer number 1? Well, we have an acute condition. We have an expected condition because pain after a fall, that is expected. And pain is psychosocial. So for now, probably not the answer. Let's look at answer number 2. 3-year-old who is drooling. So we have an acute problem. The patient doesn't want to swallow. A 3-year-old not wanting to swallow, drooling. This is unexpected. This indicates a physiological problem, airway, and the clinical manifestations are epiglottitis. Because drooling at this age and not wanting to swallow are clinical manifestations of epiglottitis, that is a medical emergency. So this patient is unstable. So if I compare 1 and 2, I have acute expected psychosocial versus acute unexpected physiological. So 2 is winning at the moment. 2 and 3. 3 is an 8-year-old who has complained in the past of a headache for 2 days. This is important. Remember, an acute unstable patient is something that rapid change in condition, rapid progresses and makes the patient unstable. And if it doesn't receive immediate intervention, the patient can die. So this 2-day problem probably does not indicate the priority. And also headache, pain, psychosocial. So we have acute, but is psychosocial. And this patient does not represent an unstable patient. So I have acute, psychosocial, stable. In answer number 2, acute, unstable, physiological. So 2 keeps winning. Eliminate answer number 3. Number 4, 10-year-old who is thirsty all the time. This is nothing new. It's all the time the same way. It's been losing weight. It needs to be assessed, but this is not an unstable acute condition. So we can eliminate answer number 4, and the correct answer is 2. These are cardinal signs of epiglottitis, medical emergency in this pediatric patient.